It's a pleasure to have with us Dr. Electra Paskett, Associate Director of Population Sciences, Comprehensive Cancer Center at The Ohio State University. Thanks for being with us.
Sure, thank you.
So what are cancer health disparities?
Cancer health disparities are differences that are observed in cancer incidence, morbidity, or mortality rates by certain population groups. So for example, I do a lot of work in Appalachia, a population that we know has lower socioeconomic level, etc. And we see disparities in both the incidence and mortality rates of certain cancers, lung cancer, cervical cancer, and colorectal cancer in the populations in Appalachia.
There must be a host of reasons for these disparities.
Right. So in the past, we've sort of looked for one reason and said, well, one reason must account for this. For example, we know smoking rates are higher in the Appalachia area. So you would then guess that the lung cancer rates are higher. But now, when we're seeing disparities, for example, among African American women in the south side of Chicago, who have the highest mortality rates for breast cancer, we're saying, well, what is it? Is it something biological? Is it something to do with access to care? Is it something else? And so we're now beginning to broaden our idea of what causes cancer health disparities.
What are the major factors that contribute to cancer health disparities?
So we're now looking at cancer health disparities on a multi-level framework. And we're beginning to look at factors from policy, for example, paying for colorectal cancer screening or mandating the HPV vaccine for cervical cancer prevention, all the way down through community level factors. Hispanics, they are very social, very dependent on family support and their community support. Is that why we see some protection in some cancer outcomes in Hispanics because of that? Through family, through personal behavior, I already mentioned tobacco, for example, to biological factors. And we're actually now looking at all of those levels together for answers to cancer health disparities, because we believe it's not just one factor that operates in isolation. It's all of these factors intersecting together that cause health disparities.
How can we make an impact in changing cancer health disparities?
I think to make an impact in cancer health disparities, we have to first of all acknowledge that there are these multi-level reasons. Second of all, we have to get the right players at the table. So for example, I'm an epidemiologist. I partner with molecular biologists, I partner with clinicians, I partner with communication experts and behavioral scientists. And together, we're approaching the problem of cervical cancer disparities in Appalachia. And by all of us contributing our expertise and working together, that's how we can address cancer health disparities.
This must really be eye-opening work for everyone that you bring to the team.
Oh, it is. It is. It's really exciting. And the other important partner in this is the community. We believe in working as partners with the community because the community really knows themselves the best and can actually help us learn about the community. And for example, culture is an important part. So something that works for women with breast cancer in Columbus, Ohio, might not necessarily work for women in Appalachia. I'm not talking about a drug, I'm talking about a communication intervention, a video where we're trying to help women identify symptoms that they might have during chemotherapy and how to then address those symptoms. The women in Appalachia saw a video that we had created and they said, women are from Columbus. We don't talk like that. So we had to redo and actually do focus groups and design a video that would be appropriate for the women from Appalachia.
Dr. Paskett, enjoyed the conversation. Very interesting work that you do.
Thank you very much.
Dr. Electra Paskett from The Ohio State University.